Today we're going to learn some of the medical counseling principles, which we can use to ace this exam, okay? Because the NAC OSCE is a very high stakes exam. And today I want us to know very well that if we're going to ace the NAC OSCE, we need to master 7 principles. I always tell my candidates, master these 7 principles, 7 key principles of medical counseling. 7 key principles of medical counseling. And what are they? You need to learn how to establish rapport. Establishing rapport, okay? At the same time, you also need to learn how to be an active listener. Number 1 is how to establish rapport. Number 2 is how to be an active listener, okay? How to be an active listener. Number 3, you've got to be empathetic and you've got to validate the patient's concerns. And number 4, you've got to have clarity in your communication. Clarity in communication. Number 5, you've got to engage the patient or the client in shared decision making. Shared decision making. And number 6, if you want to do effective counseling, you've got to learn what it means to summarize and check in for understanding. Okay, summary and checking for understanding, how to follow up and reassure the patient of what is going on. So these principles, we're going to learn them critically today and know how we're going to apply them in our NAC OSCE preparation. And so why are we learning this? Because you know what? If you want to do effective counseling, okay, you need to learn the principles. And the first principle for effective counseling is patient-centered care. And what do I mean by that? What do I mean by that? Why is patient-centered care important? You know what? The reason why you want to score high in your NAC OSCE by using the same patient-centered care approach is because you want the patient to feel heard. And at the same time, you want the patient to feel understood. And you want the patient to feel involved in their own care. So that is why we are stressing on the fact that you want to use a patient-centered approach. In the exam, we want you to demonstrate that you are hearing the patient. We want you to demonstrate that you are understanding what the patient is saying. We also want you to demonstrate that you are involving the patient and it is not just a monologue, okay? It is not just, one doctor just talking and the patient is just listening. No, we want to make sure that the patient gets what is going on. So how are you going to establish rapport? Because if you're going to, get the best out of the patient, you're going to, have to establish rapport and let the patient know that, look, I am being heard. What I am saying, the doctor is listening. So definition of rapport building is the foundation of trust, because you want to make sure the patient trusts what you're saying, right? You want to make sure the patient trusts you, basically. And rapport is the foundation of trust and effective communication between the patient and the physician. That is the essence of rapport. So if you can see here, the patient is so happy that, the doctor is listening to him, okay? So how do you build rapport? How do you build rapport in order to get the best out of the patient? So I'm going to give you some examples. So I see Dr. Hafsa on the line. So for example, I can say, hello, Mr. Smith. My name is Dr. Hafsa. How are you feeling today? Now, one other trick I want to teach you today so that you can be able to ace your NAC OSCE so far as counseling is concerned is, look at the way the doctor is sitting, smiling with the patient. You want to ensure that your body language is open. You are using an open body language, okay? And when I'm saying an open body language, one thing is you don't want to go to the patient with your arms crossed. No, that is not good. That means your body language is closed. So in the NAC OSCE exam, it's not just what you say. It's about how you say it and how you position yourself. And what can you do in order to show that you are a doctor who is building rapport with the patient? You want to use open body language. So please, from today, make sure that you are learning that principle. And what is open body language? Avoid crossing your arms, and then maintain eye contact. Maintain eye contact with the patient, because if you do that, that means you are open and the patient can communicate effectively with you. So that is the first key principle of rapport building. That's the first key principle of rapport building. Now, what are the strategies? What are the strategies I want you to write down today when you want to build rapport and when you want to get the best out of the patient? The first strategy is use small talk to find common ground. So, for example, you've gone in, "Hi, I'm Dr. Khadija too," or "Hi, I'm Dr. Jackie Lou. Okay, I'm going to be your doctor in the NAC OSCE clinic today." The patient responds. And then what kind of small talk can you use? I'm going to give you this trick. So using small talk to break the ice, you can really say, like, for example, it's summer, and those who are going to write the exam in September, it may be summer getting to fall thereabout. So you can just even talk about something very simple. "It's been really sunny lately, hasn't it? Have you had a chance to enjoy the nice weather?" This is innocuous. This is a very simple language. You don't need to worry so much about, the patient will also definitely get a response for you. Okay. Where you go like, "Look, it's been sunny lately, hasn't it? Have you had a chance to enjoy the weather?" Or if you are taking your exam in the winter, you can say, "I noticed it's a bit chilly today. Did you stay warm on your way here?" This is nothing to do with the medical encounter, but the way you put it, it causes the patient to know that, okay, this doctor is really, really interested in me. Okay, so why are you supposed to use these small talks? The trick is that it is neutral language and it is easy to relate to, and it helps the patient to feel more heard, and it's like, something you can discuss before you can break into something, critical. So that's one thing I really want you to pay attention to. It's simple language, just talking about the weather, just talking about maybe the patient's hobby. You don't really know, and that can really cause the patient to open up. So please remember, don't go with crossed arms. Lean forward a little bit. Use that language to get the patient going, and that will really, really pay off very, very well.